I did a remote practicum on the Quantum team at SESSTIM and reported to Professor Raquel Urina. And my job was to conduct a literature review about the role of social media in public health controversies, so that we could possibly identify a gap in social network research that we could possibly fill by creating an intervention program in the future. I am currently a second-year student at Mailman. I worked in the field of clinical research for 4 years before this practicum. I had experience in reading and writing scientific and technical publications for a variety of studies in cancer and Parkinson's disease research. I also had previous experience in campaign marketing and outreach after working at the National Center on Addiction and Substance Abuse, and that really helped me in supplementing my scientific knowledge while working in this practicum. Because I wanted to apply both my scientific background and my certificate of health communication to study how social networks affect communication during controversies. I also wanted to analyze how different social media platforms could be useful for people from a public health perspective, because that could be useful in the future. The practicum definitely exceeded my needs in that it taught me how to actually write a research paper, not just contribute data to it, which I had been doing in the past. And unfortunately, this was a virtual practicum, and I would have loved it to be experienced in person because workplace interactions, of course, are important to me. But based on how smoothly the practicum went, though, I expect that doing it in person would also exceed expectations. So I would definitely recommend it. It definitely helped me to better understand public health research from a social networks perspective, because I was not aware initially of the main uses of social media in health controversies. And I learned the relationship between the public and social networks, the complexity of information sharing, and the roles of misinformation and disinformation during public health controversies. And the value of these lessons is that they will inform strategies moving forward for health communication and health promotion, especially because they inform, how people use communication and their patterns of use and how they can be targeted during a public health intervention. Yes, I would definitely recommend a practicum offered by SESSTIM, especially if it is offered in person, because it is an opportunity to publish your own body of work. At least my practicum was, but you can also contribute to improving medical research. And it's a chance to learn about research protocols and customs in another country as well, to expand your knowledge of global health research practices. So if you don't have a lot of experience in that, this is a good thing to be exposed to.